Welcome to Rub Some Dirt on It, player safety and sideline preparedness.
Fires it down, made it close.
Oh, and let's hope Panetta's okay.
Again.
Oh my gosh.
Hold on.
Now that I've hopefully gotten your attention, let's go over our objectives. Number 1, understand risk management, liability, and standard of care. Number 2, create an emergency action plan. And number 3, recognize the different injuries which may occur and be able to respond quickly and accurately to each situation. 8-year-old boy dies at soccer practice. You don't think it's going to happen to you. You hear about it happening a million miles away to somebody else in another state. You don't know the situation. You never think it's going to happen to your kids or even anyone you know. He was 19. He was in college for 2 days. He died the first day of practice. The coach lied about the cause of death. There was an internal review by the college, but no independent investigation. Questions remain. Will we ever learn? Some context. Nearly all the causes of death in sport are influenced by the care provided in the first 5 to 7 minutes. Over 40 million children ages 5 to 14 participate in organized youth sports and account for almost 40% of all sports-related injuries. In youth sports, our kids 5 to 14, there are rarely sideline medical staff present. Parents and coaches are woefully unprepared to respond effectively to these emergencies. Why risk management? To avoid harm in the first place. To assure the survival of the organization when harm occurs, to provide consistent, effective approach to addressing risk, and because it's the right thing to do for our athletes. Liability, who's responsible? This is from one of the largest state soccer organizations, their risk management policy. Coaches and parents share the responsibility for the players' health while at practices, scrimmages, and games. Coaches should have an emergency plan in place. What is the standard of care? Any organizations dealing with kids must protect the health, safety, and well-being of the kids. The more something you do, the better for you. Otherwise, you're going to get slammed. In a litigious society, the best way to avoid a lawsuit is to mitigate risk by trying to prevent the injury and by having a rapid, full, and appropriate response to injuries that do occur. Now that you know the why, let's get into each type of situation. First, we'll start with emergency action planning. Emergency action plan. Who's responsible for providing on-the-field care? Who manages the rest of the team? Who manages the spectators? Who calls 911? Who meets the ambulance? Who travels with the injured athlete? Who gets the AED and makes sure one's available and maintains the AED? Same for the first aid kit. Who notifies the emergency contacts in case of the injury, and who documents the injury? How are you going to manage to keep all this information? Take a knee. Emergency action plan. Do you have emergency contact information for each athlete available to the coach while on the field? The same for the emergency medical information for each athlete? Does that include all the medical conditions and medications that the athlete takes? Are any of these medications needed for emergencies, like an EpiPen, like an asthma inhaler? Are the parents always present at games and practices? So if they're not, and it is 2019, so they may not, have you discuss coach administration of the emergency medication? Does the organization have the signed consent from the parent to administer? Is everybody on the same page with regard to all this? And once again, what type of system do you have to manage all this and keep everybody on the same page? Finally, do you require a pre-participation physical? Why is it in high school sports you must have a pre-participation physical, but in youth sports, probably not? Why not? Pre-participation physical. There's a history portion that's completed by the parent and the athlete, which should be reviewed by the physician, and the examination portion completed by the physician, and this should be discussed with the parent and the athlete. At barest minimum, the parents and the athletes can complete the history portion, which is available for free using this link. It's the American Academy of Pediatrics Pre-Participation Physical Examination. I would strongly encourage all organizations to have the parents at barest minimum complete this history form. Preferably, all organizations should require a pre-participation physical. Sudden cardiac arrest. What are the signs, symptoms, warning signs of sudden cardiac arrest? Fainting, blackouts, dizziness, unusual fatigue and weakness, chest pain, shortness of breath, nausea, vomiting, palpitations, a family history of sudden cardiac arrest at age under 50. This is very important. That's why the pre-participation physical. So are there really these warning signs, and do they occur? Yes, they occur, but people have to be very observant. What does sudden cardiac arrest look like? Let's see.
What?
That was Zeke Upshaw in an NBA G League game. Sudden cardiac arrest, and he died. Google that story. It's a very sad story of lack of preparedness. And this story, a youth athlete in a baseball game. People did not know what to do. Everyone was out there pouring water at him. If the paramedic, who happened to be in the stands, didn't get to the defibrillator on time, this boy would have died. Make sure your coaches are trained. Make sure there's an AED that's immediately available. The statistics in sudden cardiac arrest. Unfortunately, bystander CPR is initiated in less than 1/3 of the cases of witnessed sudden cardiac arrest, and most of the time the chest compressions are not of great quality. The AED needs to be immediately available, targeting a time interval of less than 3 to 5 minutes from collapse to first shock. What does the pad placement look like? Well, please take your CPR class, but in an adult, which Red Cross and American Heart define usually as 8 years old and up, the pad is upper right and lower left chest. For a child between 1 year old and 8 years old, front of the chest and the back. The heat. Most of you in Think Tank are aware of what happened at University of Maryland and the death of Jordan McNair. What are the signs and symptoms of heat exhaustion? You can see irrational behavior, altered consciousness, coma, disorientation and dizziness, headache, confusion, nausea, vomiting, diarrhea, muscle cramps, and you can read the rest. Become familiar with these, and most important is pay attention to your athletes. Having an all-out workout on day 1 of practice may not be the best idea. Does your organization have a heat plan? Again, take a course, a full course in heat and heat injuries. But here is a heat plan. If you have a wet bulb globe thermometer and you know how to use one, these are the most accurate way to assess the risk of heat injury. You can use the heat index, which is available on any weather application on your phone. But it doesn't take much to understand that hot is hot. And if it's really hot outside, is it wise to have a brutal, long practice? Probably not. What is your action plan? Cool first, transport second, calling 911. There's 100% survival if cooling is begun within 10 minutes. Immerse the athlete almost to the neck. Remove excess clothing if you can while the athlete is in the tub, stirring the tub, keeping the ice moving. Monitor the athlete. As you can see, somebody's holding the athlete up, keeping their hand on their head and chin so they don't slide completely into the pool. This is just a kiddie pool, which can be purchased for under $10. It also is much easier to get an athlete, especially a youth athlete, into a kiddie pool. If the athlete's really big, getting one of those high-sided pools, it can be very, very difficult to get the athlete in and out of that. A kiddie pool works great. If you do put an athlete into the pool, time how long the athlete is in the tub. This is very important information for the emergency responders. I understand that it's highly unlikely that you as a youth coach are going to take a rectal temperature, so we're not going to worry about that. We're going to pay attention to the athlete and inform EMS when they come. What does your heat plan look like? This is a complete heat plan. Acclimate the athletes to heat over a minimum. This is a minimum of 8 to 14 days. Finding out what the kids did over the summer is very important. If the kids were inside playing video games, those kids are going to have a completely different situation than the kids outside who may have had a lawn service job. You must gradually increase intensity and length of practice. You're going to have a plan using a wet bulb glow thermometer, the heat index, or even just the temperature. Pick one and follow the generic guidelines. Provide a shaded area, a tarp or an easy up tent for breaks in the practices. Provide that kiddie pool with an ice bath. Even just the cooling of the feet and hands can be very, very helpful. Have plenty of ice and coolers, spray bottles, cooling towels. Also, are the athletes being weighed twice a day before and after practices? This is something that you can engage your parents with. If there's greater than a 2 to 3% weight loss as compared to the prior day, advisable for the athlete not to participate. This can be very, very significant, and most of the heat stroke cases, it wasn't that one day. When you really look into the history, it was over multiple days that most of these athletes had issues. You're going to have the athletes replace every pound lost with approximately 16 to up to 24 ounces of fluid. However, the athletes must sip, not gulp that fluid. You're going to drink to thirst on an everyday basis. That will be the ideal. You may want to replace the sodium. Athletes can discover this as to whether or not they have very salty sweat. Going to make water and rest breaks every 15 to 30 minutes. Shorter breaks, the hotter the practice. Pay attention to your athletes. Have a buddy system. And athletes, you can teach them to observe the urine color. If it's darker yellow, brownish, that's a problem. Stay hydrated.
This is one of them deals you wouldn't wish on anybody, ever.
They say that'll never happen to my kid, and then it happens to your kid or it happens to somebody you know, and it opens your eyes, and that's all we're hoping for, is that it opens somebody's eyes, that somebody's listening.
The Robert Back story is a very sad story. It's a story of poor communication and poor documentation. Even though there was an athletic trainer, there was a concussion protocol, there was coach education. Even with all of that, communication and documentation completely broke down because there was no system. Concussions are a brain injury. It is caused by a direct blow to the head or other part of the body. Symptoms can occur quickly or be significantly delayed, may be short-lived, or last a while, meaning months or years. You don't have to be knocked out, be knocked unconscious to have a concussion, and concussions don't show up on regular imaging studies. What does it look like? When to seek immediate medical care. Change in the pupil size, one larger than the other, a drowsiness or inability to wake up, headaches getting worse, weakness, numbness, decreased coordination in the arms or legs, severe neck pain, loss of range of motion in the neck, dizziness, repeated vomiting or nausea, convulsions or seizures, what is known as the fencing response, change in behavior, and confusion, restlessness, agitation, combativeness, slurred speech, inability to recognize people or places, athletes less responsive, the athlete will not stop crying, and of course, loss of consciousness, even the most brief loss of consciousness, should be considered an emergency. We all must become better observers. We have signs and symptoms. Signs are what you observe. Symptoms are what the athlete reports. So we've just reviewed the emergency signs and symptoms. Here's what to look for, a long list. Do you have this list? Is this list going to be immediately available to you? And how are you going to document which ones of these signs and symptoms that you see on the sidelines? Having a system is critical so the signs and symptoms can be immediately documented and immediately communicated to all the stakeholders in your organization. The bottom line with concussions and any injury is, when in doubt, take them out. These are youth athletes. When in doubt, take them out. The issues of return to learn and return to play. Take a concussion class because these are very, very important issues. But the bottom line is return to learn is getting the athlete back into school. In a school system where there's an athletic trainer to supervise this program, it's much easier. However, if the child's in a league or a club, who's going to supervise that return to learn process? Is the school, the parent, the coach, is everybody on the same page so the child can gradually get back into a full academic program? The same with the actual return to play. Again, in a school system, there should be hopefully an athletic trainer to supervise this, but in a league or club, probably not. So who's going to supervise each step from a day, 2, 3 of no activity, physical activity, to light aerobic exercise, something that gradually increases the heart rate, to more sports-specific exercises, to training drills and weightlifting, and then back to full contact practice? Is the athlete completely symptom-free for a 24-hour period after each stage? Who is supervising that? Very, very important to have that documented and for parents, coaches, and league officials to be on the same page. Asthma. Every 10 seconds, someone has a potentially life-threatening asthma attack. 90% of asthma patients do not use their inhaler correctly. You're looking for severe breathlessness. If you see that, call 911. It's very important to understand how to use the inhaler. When we're dealing with young kids, most of the kids do not know, and unfortunately, most of the parents don't know. So once again, it's important to have a signed release by a parent to make sure that you as a coach can administer if the parent's not there. And where's the inhaler in the first place? So how to use an inhaler? Very quickly, we want to prime the inhaler, kind of like shaking a can of spray paint. We're going to shake to mix the medication and the propellant. So we're going to shake, and spray, holding it as the picture, as you see in the picture. Index finger on the top on the canister and thumb on the bottom. So the bottom side is the inhaler hole. You're going to have the athlete sit straight up. The athlete's going to put the inhaler into the mouth with the lips around it. You're going to have the athlete start to breathe in. Once they start to breathe in, they can spray it. They can push down, spray it once, and continue to breathe in. You're going to remove the inhaler from the mouth after the spray, and the athlete's going to hold their breath for 10 seconds or as long as they can. They're going to then breathe out gently, letting all the air out and waiting 30 to 60 seconds preferably before they do a second puff. How many puffs do they need? Well, this is something that needs to be reviewed with the parent, who hopefully has this information from the doctor, and they should be very familiar with how to use it. Every inhaler is different, and every emergency dose is different. This is why having the individual information for that particular child is critical. Once the athlete is done, they should be rinsing their mouth with water, spit it out, and they must follow up with their healthcare provider.
You better give yourself a shot.
Yes, anaphylaxis is very scary. Thus, being prepared for it is critical. Do you know how many kids on your team in your organization need an EpiPen? Very important. This is what they look like. There are generic versions. Most of you will not see the EpiPen Junior because that is for a person that's under 66 pounds, 30 kilograms. So most of you will see the regular EpiPen. It's in a case. Remember the mnemonic: orange to the thigh, blue to the sky. So when you hold the EpiPen, you must hold it as shown, like a fist with your thumb around it. If you put your thumb on the top and you put the wrong end against your thumb, you may end up injecting it into your thumb. This has happened many a time. You punch the EpiPen into the upper outer thigh and hold it there for 3 full seconds. Watch some videos, take a course, talk to the parent. You must learn how to use the EpiPen. Again, it's a very scary situation, and it's not something you want to be wondering what to do with when it happens. Stay with the athlete, call 911, get in touch with the parents, and you should have 2 EpiPens because the first dose may not work. MRSA, or methicillin-resistant Staphylococcus aureus. You don't need to remember this. You don't need to become a dermatologist. You just need to know it's an ugly, oozing skin condition that you probably don't want to touch. Good basic hygiene will take care of this if good basic hygiene is always practiced. However, if an athlete has this, they must see a doctor. They must be removed from play because this can spread like wildfire and it can kill a person. So it's very, very important to be aware of your athletes. You're probably not going to be checking the complete body of every athlete that you have, but if you do notice something like this, it's very, very important to pull the athlete out and talk to the parent. Seizure disorders. Do you know if your athlete has a seizure disorder? If they experience a seizure, you must call 911. The most important thing, cushion and protect the head. Move harmful objects out of the way. Don't restrain the athlete. Don't put anything into their mouth. Don't try to open their mouth. If possible, remember to time the seizure. How long does it last? Very important information for the paramedics and for the athlete's physician. If the athlete becomes unresponsive, you must start the CPR protocol. After the convulsions stop, you can turn the athlete on his or her left side. Remain with the athlete until the ambulance arrives. Bleeding. Pack the wound. You must have a good pair of gloves. You must have sterile gauze available if an athlete has severe bleeding. So you're going to pack or stuff the wound, holding pressure on it, wipe the pooled blood away, and just maintain that pressure on the area. If need be, call 911. Nosebleeds. Nosebleeds are usually resolved by simply holding the pressure on the nose as shown in the image and not frequently peeking at it. In other words, don't let up the pressure. Keep the pinch there until the bleeding is completely controlled. Keep the head elevated but not tilted way back, because that position, tilting it way back, may cause bleeding into the throat and the lungs. Rhabdomyolysis. This is something that unfortunately has recurred way too many times. Recently in Texas and Houston, 12 women on the soccer team were pushed into a very hard workout. Rhabdomyolysis. What does it mean? Rhabdo refers to the rod shape of muscle. Myo literally means muscle, and lysis means breakdown. That means an excessively hard workout, and what's excessively hard for one person may not be excessively hard for another. It causes a breakdown to the muscles. This can cause kidney failure. It can cause something called compartment syndrome. It can even cause death. Muscle pain and soreness, muscle tenderness, weakness, joint pain, swelling, nausea, dizziness, fatigue, vomiting, confusion, fever, rapid heart rate, dark cola-colored urine are all signs and symptoms of rhabdomyolysis. And I think what you're seeing is many of these signs and symptoms can be similar. So heat injuries can sort of look the same. Brain injuries can sort of look the same. Paying attention to our athletes is critical. And a first aid kit. What should you have in a first aid kit? Well, you don't need a wilderness first aid kit, but most store-bought first aid kits have poor quality cases, so the zippers frequently break and the fabric frequently rips. The scissors are usually plastic and the thumb holes are not big enough for people with large hands. The gloves are usually cheap quality and they tear too easily. And the Band-Aids are usually poor quality. So those are the items that you may want to purchase separately and buy a nice bag. The tool bags at any hardware store are great bags because they're very rugged bags. In addition, having a fanny pack for getting onto the field for injury care, having the right pair of gloves. You can purchase them at any CVS or store. First aid kits should have a properly prepared first aid kit. A few things to note: most of the store-bought first aid kits have poor quality cases, so the zippers break, the fabric rips. The scissors are usually plastic and small, cheap. Sometimes they're so small that you can't even fit a man's thumb or index finger into the scissors. The gloves are usually poor quality, they tear easily, and they're kind of small. And the Band-Aids are not very good quality. So those are some items you may wish to purchase separately and get better quality case. A tool bag is an excellent case for a first aid kit. Get a good pair of athletic training scissors. Get a good box of gloves. Get a good set of Band-Aids. Fanny pack to hold gloves, scissors, sterile gauze, rolled gauze, a pocket mask, a small flashlight, and a spray water bottle for wound cleaning. One quick note is that hydrogen peroxide can slow healing, but sometimes it's also good to have the spray peroxide if things get really, really, really dirty. So in summary, and I know that was a lot, but you have a lot of information there that you can review. Please have a risk management strategy. Please have an emergency action plan and think about before each game, are you ready for an emergency? Before each practice as well. Have you educated your coaches properly? Have you implemented a full safety system and created that culture of safety so everybody can be on the same page in real time? And now you can take a deep breath because you have safety and risk management prepared, and finally, have fun. I'm Dr. Steve Horowitz, TeamSafeSports.com, at TeamSafe Sports on Twitter and Facebook, Dr. Steve at TeamSafe Sports. Please join our TeamSafe Sports network, receive the free report, Tackling Concussions. Don't drop the ball on brain safety. Just go onto our website and enjoy the kids.